There is something happening at your doctor's appointments that most people never notice, and once you understand it, the way you think about your own health is going to change completely. Every time you get a blood test, your doctor receives a report with dozens of values on it. They scan through those values, they circle a few things in their mind, they decide what to mention and what to file away, and then they walk into the room and tell you what they want you to know. But here is what most people never ask and almost never find out. What are the numbers they looked at most carefully before they walked in? What are the values they are tracking quietly, visit after visit, without necessarily explaining why? There are 3 specific numbers that doctors pay close attention to in a way that goes well beyond what they typically discuss with patients, and understanding what those numbers mean, why they matter so much, and what they are actually telling you about your long-term health could be one of the most important things you do for yourself this year. Stay with us until the very end, because the 3rd number is the one that almost nobody knows about, and it may be the most revealing of all. Before we get into the numbers themselves, it is worth understanding why doctors sometimes don't explain everything they are watching. This is not about conspiracy or secrecy. It is about the reality of a short appointment, a list of concerns to cover, and a patient who may or may not be ready to hear and act on information that requires explanation and context. Many doctors have found that sharing complex lab values without adequate context leads to anxiety without action, which doesn't help the patient. Others simply follow the standard practice of flagging values that fall outside the clearly abnormal range while monitoring borderline values over time without drawing attention to them until they require intervention. The problem with this approach, however well-intentioned, is that it leaves patients without the information they need to make lifestyle and dietary changes that could prevent those quietly watched numbers from ever crossing into the danger zone. And that is exactly what this video is here to address. The first number is your fasting insulin level. Not your blood sugar, not your A1C, but your fasting insulin. If you have ever had a blood test and seen glucose or A1C on the results, you may have wondered why insulin itself is rarely measured. The reason is that standard diabetes screening protocols focus on blood sugar levels, which only show a problem after it has already become significant. Insulin, however, reveals the problem much earlier, sometimes 10 to 15 years before blood sugar becomes abnormal. Here is why this matters so profoundly. When someone begins developing insulin resistance, which is the underlying mechanism of type 2 diabetes, their cells gradually stop responding efficiently to insulin. In response, the pancreas produces more and more insulin to compensate and keep blood sugar from rising. Blood sugar stays normal for years, sometimes decades, while insulin levels quietly climb higher and higher. If a doctor only checks blood sugar, everything looks fine. But if they check fasting insulin, they can see the problem developing long before it shows up anywhere else. A fasting insulin level that is higher than the ideal range, even when blood sugar is completely normal, is one of the earliest signals that the body is moving toward metabolic dysfunction. Elevated fasting insulin is associated not just with future diabetes risk but also with cardiovascular disease, certain hormone imbalances, increased inflammation, and in research settings it has been associated with a higher risk of several chronic conditions. Doctors who are truly focused on prevention rather than just treatment watch this number carefully. They notice when it starts creeping up over years of visits. But many patients never know their fasting insulin has been measured, or what their number means, or that it was quietly rising. If you have never had your fasting insulin specifically measured, asking your doctor about it is one of the most valuable conversations you can have about your long-term health. And if it has been measured, finding out what that number actually was and what trend it has shown over time gives you a window into your metabolic health that blood sugar alone simply cannot provide. The second number is your triglyceride to HDL ratio. Individual triglyceride and HDL cholesterol values appear on most standard cholesterol panels, and most people have had these measured multiple times. But the ratio between them, which requires nothing more than dividing one number by the other, is something doctors track in a very different way from how they typically discuss it with patients. Here is why this ratio matters so much. A low triglyceride to HDL ratio, generally considered to be below 2 when using milligrams per deciliter measurements, indicates a metabolic environment where insulin is working efficiently, inflammation is relatively low, and the risk of cardiovascular disease is correspondingly lower. As this ratio rises, it indicates increasing insulin resistance, worsening metabolic health, and a significantly higher risk of heart attack and cardiovascular events, even in people whose individual cholesterol numbers might not look particularly alarming in isolation. Research has found that the triglyceride to HDL ratio is one of the strongest predictors of cardiovascular risk available from a standard blood test, in some studies outperforming individual cholesterol measurements in terms of predictive accuracy. It has also been found to correlate closely with insulin resistance, making it a useful surrogate marker for metabolic health even in people who haven't had fasting insulin measured. A ratio above 3 is considered elevated, and a ratio above 5 is considered significantly concerning, yet many people with ratios in this range are never told that this particular value is something their doctor is paying close attention to. They receive their cholesterol panel, are told their LDL is being managed or that everything looks acceptable, and leave without knowing that one of the most informative pieces of their blood work is a simple calculation away. The good news is that this ratio responds meaningfully to dietary and lifestyle changes, particularly reducing refined carbohydrates and sugar, increasing physical activity, and improving sleep, often showing improvement within weeks of consistent change. The third number is your estimated glomerular filtration rate, or eGFR, and this is the one that surprises people the most because it doesn't appear in conversations nearly as often as blood pressure or cholesterol. Your eGFR is a calculated estimate of how well your kidneys are filtering your blood, expressed as a percentage of the filtration capacity of young healthy kidneys. An eGFR of 100 means your kidneys are filtering at full expected capacity. An eGFR of 60 means they are filtering at 60% of that capacity. The reason doctors watch this number so carefully and so quietly is that kidney function decline is almost completely silent until it reaches an advanced stage, and because it declines gradually over years, a steady downward trend in eGFR across multiple visits is one of the most important warning signals a doctor can observe, even when each individual number is still within the technically acceptable range. Here is what most people don't know about eGFR. A value above 60 is generally considered acceptable, but a value that was 83 years ago and is now 68, while still technically normal, represents a meaningful decline that a doctor is almost certainly noting with concern. The trend matters enormously, and doctors track eGFR trends across visits over years with a level of attention that is rarely communicated to patients. This is partly because there is limited acute action to take in the earlier stages of decline, and partly because many doctors don't want to create unnecessary anxiety about a number that hasn't yet crossed into the clinically abnormal zone. But the consequence of this well-intentioned silence is that patients whose eGFR is quietly declining have no idea that they should be reducing their sodium intake, staying better hydrated, avoiding regular use of certain over-the-counter pain medications, managing their blood pressure more carefully, and getting regular follow-up kidney function tests. All of these steps can meaningfully slow the progression of kidney function decline, but they require the patient to know that their kidneys deserve this attention, which they cannot know if nobody tells them their eGFR trend is something worth watching. Now let's connect all three of these numbers because the relationship between them is one of the most important and least discussed patterns in preventive medicine. Elevated fasting insulin reflects insulin resistance. A high triglyceride to HDL ratio reflects insulin resistance and cardiovascular metabolic dysfunction. Declining eGFR can be accelerated by insulin resistance, high blood pressure, high blood sugar, and inflammation, all of which are downstream consequences of the metabolic dysfunction that elevated fasting insulin first signals. These three numbers are not independent of each other. They are three different windows into the same underlying process. A gradual drift toward metabolic dysfunction that begins silently, progresses slowly, and becomes increasingly difficult to reverse the longer it goes unaddressed. A doctor who is watching all three of these numbers is building a picture of your metabolic health that goes far deeper than any single value can reveal. Understanding why this matters so much requires stepping back and thinking about how chronic disease actually develops. Most serious health conditions in older adults, including type 2 diabetes, cardiovascular disease, chronic kidney disease, and even some forms of cognitive decline, do not appear suddenly. They are the end point of a process that began 10, 20, or even 30 years earlier, developing silently through gradual changes in exactly the kinds of biological markers these three numbers reflect. The opportunity to meaningfully change the trajectory of these conditions exists primarily during those early decades of silent progression, when lifestyle and dietary changes can still reverse the underlying process rather than simply managing its consequences. This is the window that these three numbers can reveal, and this is why doctors who are focused on true prevention, rather than only on disease management, watch these numbers with a level of quiet attention that often doesn't get communicated to the patient who needs to understand it most. Let's talk about what you can actually do with this information, because awareness without action is incomplete. The first step is to request that your next blood work specifically include fasting insulin if it has not been measured recently. This requires a specific request in many medical systems, as it is not always included in standard panels. It also requires a true fasting state, meaning no food or calorie-containing beverages for at least 8 hours before the test. The second step is to look at your most recent cholesterol panel and calculate your triglyceride to HDL ratio yourself, which simply requires dividing your triglyceride number by your HDL number. If the result is above 2, it is worth discussing with your doctor. If it is above 3, it warrants genuine attention and conversation about what might be driving it. The third step is to find your eGFR on your most recent blood work and then, if possible, compare it to eGFR values from previous years. If it has been declining steadily, that trend is worth raising explicitly with your doctor as a concern you want to discuss and monitor actively. Beyond these specific steps, the lifestyle factors that most directly support healthy levels across all three of these numbers share significant overlap. Reducing intake of refined carbohydrates and added sugars is one of the most consistently effective interventions for improving fasting insulin, improving the triglyceride to HDL ratio, and supporting kidney health by reducing the metabolic burden on the kidneys. Regular physical activity, even moderate amounts like daily walking, improves insulin sensitivity in ways that directly benefit all three markers. Adequate sleep, which is increasingly understood as essential to metabolic health, affects insulin sensitivity, triglyceride levels, and blood pressure in ways that have downstream effects on kidney function. Staying well hydrated supports kidney filtration directly. And managing blood pressure carefully is perhaps the single most important protective factor for kidney function over the long term, since hypertension is one of the primary drivers of eGFR decline. It is also worth mentioning that you have every right to ask your doctor to explain every value on your blood test results, including what the trend has been over time and whether there is anything on your results that they are monitoring without yet recommending action on. Let's also spend a moment on something that ties these three numbers together in a way that is rarely discussed outside of specialized medical literature, which is the concept of metabolic age versus chronological age. Two people can be the same calendar age and have dramatically different metabolic profiles based on their fasting insulin, their triglyceride to HDL ratio, and their eGFR trend. Someone who is 65 with a fasting insulin in the ideal range, a triglyceride to HDL ratio below 2, and a stable eGFR above 80 has a metabolic profile that in many ways resembles someone decades younger. Someone the same age with elevated fasting insulin, a high triglyceride to HDL ratio, and a steadily declining eGFR is carrying a metabolic burden that significantly accelerates the aging of their cardiovascular system, kidneys, and brain regardless of what their birth certificate says. This is why these numbers matter so much beyond simple disease risk. They are a reflection of how your body is actually aging at the cellular and organ level, which is ultimately what determines quality of life and independence as the years pass. There is also an important point to make about the window of opportunity that these numbers represent. Many people assume that once they receive a concerning value, the damage is already done and the situation is largely irreversible. But the research on metabolic health tells a very different and much more hopeful story. Fasting insulin responds to dietary changes remarkably quickly, sometimes showing meaningful improvement within weeks of reducing refined carbohydrates and sugar. The triglyceride to HDL ratio can improve substantially within months of consistent dietary and lifestyle changes. And while eGFR decline cannot always be fully reversed, its rate of progression can often be meaningfully slowed through blood pressure control, dietary adjustments, adequate hydration, and avoidance of kidney-stressing medications. The earlier in the progression these changes happen, the greater the opportunity for meaningful improvement, which is exactly why knowing about these numbers before they become emergencies is so much more valuable than learning about them after a crisis has occurred. One final thought worth sharing is about the relationship between these three numbers and how you feel day to day. Many people assume that if they feel reasonably well, their health markers must be acceptable. But the three numbers we have discussed are among the clearest examples of why this assumption is dangerous. Elevated fasting insulin for years before diabetes develops rarely causes symptoms. A high triglyceride to HDL ratio rarely causes pain or obvious discomfort. Declining eGFR is almost entirely without symptoms until kidney function is severely compromised. Feeling fine is not the same as being metabolically healthy, and the people who discover these numbers are quietly moving in the wrong direction before symptoms appear are the people who have the best opportunity to change course before serious consequences follow. It is a completely reasonable expression of engagement with your own health, and a doctor who values patient education will welcome it. If you have been told your results are normal and everything looks fine, it is completely appropriate to follow up by asking whether there are any values that are within normal range but trending in a direction worth paying attention to. That question alone can open a conversation that gives you exactly the kind of information this video has been talking about. Before we close, it is important to say clearly that this video is for general educational awareness only. The specific interpretation of your lab values, including fasting insulin, triglyceride to HDL ratio, and eGFR, needs to happen in the context of your complete medical history, your current medications, and your overall health situation, all of which only your doctor has access to. Nothing in this video should be used to self-diagnose or to make changes to medications or medical treatment without professional guidance. What it can do is give you the knowledge to ask better questions and to understand the answers more fully when those conversations happen. If this video gave you something genuinely new to think about regarding your own health, please share it with someone you care about, because this is the kind of information that most people never encounter unless they specifically go looking for it. If you found this video helpful, please like it and subscribe to Dr. William Hart Health for more videos like this every day.